Okay, I'll redo everything. No, I'm kidding. That's okay. So the recording has started now. And just want to mention a little bit of the fuel for my journey and why I'm motivated to do the kind of research that I do from a personal standpoint. And this is an image of my mom under a tree, and it's not her hair. It looks like it's really well positioned. I'm first generation Canadian. My parents came from Cambodia after the war, and my mom would always share stories about her grandfather who unfortunately went missing during the outbreak of the war. He wandered away from home. Is there a question there? Is there any way to see the presentation more clearly? Oh, is it not clear enough for others?
I think it's just the presenter to see you
To
closer.
see me.
Yeah.
Oh, sorry. I wish I could move forward. I'll position myself closer. I think this is probably as far as close as I can. But maybe when it's Q&A, I'll come closer to the camera so you could see me. But yes, just going back. So my mom was an early caregiver for her grandpa. And he went missing and he was never found, unfortunately. And she would always share stories about how she would do all of these activities and just spend time with him. And unfortunately, there weren't any programs at all or a lot of education there to understand what her grandfather was going through at the time. So that's from a personal angle of why I really wanted to pursue research in the area of aging and dementia. From a clinical standpoint, I'm also a registered nurse, and I worked clinically for almost 10 years as well at an acute care hospital in Hamilton, Ontario. And I worked on a unit where most of the clientele were people living with dementia, and I've had the opportunity to learn from them and learn from their family members as well. So I've been really privileged. And I also noticed that there are many gaps in the hospital setting, as I'm sure in British Columbia you must face the same in terms of strong use or lots of use of pharmacological versus non-pharmacological strategies, and restraint still being used, although we know it's not best practice. So lots of that fueled the motivation for me to pursue graduate studies when I was a registered nurse. And from a research point of view, my research has evolved, but I've always really been interested in the non-pharmacological aspects of supporting people living with dementia and their family members and friends as well, because I find this is a dyad that you really can't separate, and you do need to look at the whole person and the people who are supporting them as well. And from a social angle, I just find that it's part of my social justice and community work to support, and it's really something we should, as a society, feel the impetus to do more for people living with dementia and their family and friends. And I don't think I have to mention, but we all know we're in a growing aging population, and there's going to be more of a need for such programs or innovative ways of thinking as well. So that's just a little bit about me. So the first study I'm presenting to you is actually from my postdoc from a couple of years ago, and I was fortunate to have funding from the Alzheimer's Society of Canada and also the CCNA, Canadian Nurses Foundation. So I developed a community of practice for family and friend caregivers in collaboration with a person living with dementia and family and friends who are supporting currently or former supporters of people living with dementia, either at home or in long-term care. So we had a mix of people there. And I'll also talk about Namaste Care, which is a multisensory program, which I'll discuss further and provide some examples. The team members that were part of this project was myself, the 9 caregivers, and a 1 person living with dementia, and we were situated across Canada. So we had people from BC as well, as you can see, and we all met virtually. So this was a virtual co-design project. And then at the time, my postdoc supervisor was Dr. Sharon Kasalainen, and Dr. Carrie McKaney was one of my committee members or part of my member for the project. All right. I think, as we all know, there are many challenges as we have seen the increasing prevalence of dementia, especially across Canada, continues to grow exponentially. Unfortunately, many caregivers still report that they still have an unmet need related to dementia education, and it could be different aspects of dementia as well, whether it's activities, meaningful activities, or just help with the day-to-day types of care. And there's also a need for support from caregivers. So they still feel like there's a need for a community aspect where they could meet with others who share similar experiences. So based on those challenges, I've decided to create a community of practice that's available online, and I also have a website that people can access, and it's still readily available for those to use. So this place is a place where people can come to access resources. It's available in 52 different languages. So I did compile a list of websites and videos and YouTube links and things like that on the website, so people can access that. And I started off with maybe 5 resources, and it has grown quite a bit because of the recommendations of my care partners, my research partners who worked with me. This is also a place where people can meet regularly and share concerns. So we also have discussion forums. So every 2 weeks I would hold discussion forums, provide a bit of education, and the topics were determined by those who were attending. So I had some care partners come and let me know what they'd like to learn about. So they had regular interactions, and this was all hosted virtually. And Namaste Care was also a program that was embedded into this virtual community of practice. So Namaste Care originated in the US. It was created by Joyce Simard, and she created this program especially for people with more advanced forms of dementia, but since then it has been adapted for different use and across different cultural contexts. But essentially it's a psychosocial multisensory program that looks at having a more comfortable environment and a loving touch in caring for people with dementia. So oftentimes in long-term care, for example, it's provided in a setting in a room where you have a group setting and nice music's being played, there's storytelling, conversations happening, snacks as well, and touch is a big component. So there might be hand massages happening, lotioning, and things like that. So it hasn't really been looked at from the care partner's perspective. So what I was interested in doing is actually training or providing education for care partners to be able to deliver some of these activities either at home or when they're visiting their family members in long-term care. And I have, some quotes to share with you about what they thought of the program as well. So yeah, some of the things that I really received in terms of the findings, that the resources were helpful, they were easy to access. They appreciated the different languages used in accessing the resources, and they found it was fairly easy to navigate for the most part. So those were some of the feedback. So I did 2 workshop sessions. First, I just showed a very bare bone draft, and the second one I was able to incorporate the recommendations. So right now we have resources, as mentioned, in different languages. We also found that it was really important to be able to tailor the activities for different stages of dementia and cultural considerations. So I had one care partner who mentioned that their mother loves snacks that are more familiar in the Chinese culture and music that's more readily accessible to them and familiar. So we really need to take that into consideration. And then there's also self-care resources for caregivers as well. And that was something that was really important because caregivers, as we know, do need also that support for themselves, not just for people living with dementia. This is a quote from a research partner, and they found that the information was very helpful. It was really good and easy to access. They learned something that was practical, that they can actually put into use in the care of their family member or friend. And it was not something that they really had to, focus really hard on retaining. So it was things that they needed, and it was easy, and it didn't require any recall or anything like that. And this is a photo of some of the boxes that I sent. So I actually created packages free of charge, and I mailed these across Canada. So I did this during my PhD work and also during my postdoc. And I would do an assessment with care partners and people living with dementia if they were able to communicate their needs. So I would talk with them and discover some of the things they like doing, and I would trial. And if they didn't use something, then that's okay. And I would also mail frequent other items too if there's something else they wanted to try. So depending on their stage. So there were snacks that I've mailed, puzzles of different pieces, and there were blankets and all kinds of things that they might be able to use. I think what was also really popular was the magic bean bag that provided some comfort for them. So it really helped when they were in pain or they just wanted that warmth. So they really appreciated having that for them. And I also provided them with the adapted Namaste Care training program guide. So this was actually developed during my PhD, where I also worked with research partners in creating this. So this was a 12, 15-page guide and it provides them with ideas and examples of how to implement that Namaste Care program. And this is actually also freely available on my website, so it can be accessed by anyone at any time. So lots of care partners found that this was a really helpful resource for them to be able to deliver the program. They also appreciated those discussion group sessions that were led by myself every 2 weeks. And these were some of the topics that we did talk about. So some of them wanted to know about safe use of medications, how to manage pain, or even how to recognize pain in people living with dementia. There were discussion or needs for nutrition. That was something that people worried about. And also they even actually suggested palliative care, and some of them were ready to talk about that. So these were topics that came from the care partners themselves and not really suggested by myself. So as they started to feel comfortable in voicing some of their needs, these were the things that, really were important to them. And I also evaluated the program not just through qualitative interviews with their care partners, but I also looked at the system of usability scale, and it rated quite high in the A levels in the 90% range, where I wanted to make sure that it was easily accessible and there weren't any major glitches there. And if there were any comments, I would go back and try to fix the website as well. And I think it's really important when we are engaging people with lived experience in these kinds of workshops to evaluate that in some form. So I use the public and patient engagement evaluation tool. And we also did interviews to ask how engaged they felt. Did they feel that their ideas were taken into consideration, and just the overall experience. And for a lot of these research partners, it was their first time taking part in research, and they really weren't sure how they would contribute, but in the end, they felt that they did contribute quite well in terms of creating the resource there. Another lengthy quote, I won't read it all, but this is from a participant who actually implemented the program. And they mentioned how it was really helpful to have those online resources, but also the hard copy, that training manual really was important, because I think a lot of us need something tactile to be able to flip through without having to search. And it was helpful for them to get ideas. Some of them are running out of ideas on what to do when they're visiting their family member or friend, especially in long-term care, because as we know, dementia progresses and the way that we communicate has to change as well. So the checklist gave them lots of ideas, and they were grateful for the care packages. So they didn't have to go out and buy all of these items. It was conveniently delivered to them. So they didn't have any of that guesswork. So it really felt reassured that they were doing as best as they could. And I even had a caregiver participant mention that some of the family members passed away near the end of the program, and they were just grateful to be part of this and to be able to implement this all the way to the end of life for them. So my next steps is publishing a manuscript on the findings, and it's still in the works. It's been a couple of years, and I have gotten back to it. So we're at a point where it's currently being reviewed, and I've sent in revisions. So as soon as that's published, I'm really pleased to share that with everyone. I have presented some of these findings at conferences like the Canadian Association of Gerontology, and I'm also continuing my work on something called the In Touch project, which is part of the Horizon Europe grant. So as a co-PI, we're actually looking at implementing Namaste Care in European long-term care homes right now, and we're in charge of the research engagement with people with lived experience aspects. We're working with care partners right now from Canada and also Europe. All right, so that was the first of the 4 studies. So on to the next study that was also near and dear to me, and it's exploring the behavioral approaches for people living with dementia. So this is looking more at the approaches that exist. And I'm going to be focusing on my trips. I've had 2 trips to the Netherlands where I collected some data. So the last one was a couple of years, way back in 2023 or so. So I have lots of photos. I do like sharing photos because it speaks volumes rather than me explaining. But just to start with green care, it's just an overall definition. So it's looking at the psychological, social, or all those types of interventions that involve plants, nature, and or animals. So so settings don't necessarily need to have animals. Some settings have just plants or nature-based or gardens, and others may have animals. And it could just be, one horse, or it could be a variety of different animals. So the definition varies quite quite a bit, and there's not really a standard there. And the activities could either be passive, so you could just be sitting outside in the garden enjoying the view, or it could be more active where you're actually caring for the animals, tending to them, feeding them. So there's in Netherlands, it's a combination of that. We also, you'll probably see in the Netherlands, they're really big on using the term green care farms. I do have a bit of a disclaimer though, because there is a movement where we're trying to move away from the term farming because of the colonial land use it has been known to be associated with. So personally, I prefer to call it green care or green care approaches. And in the UK and in different parts, they're also using green care, green health, I think more so. You might come across land-based care, green care approaches as well. So green care farms is probably more of a Eurocentric or European model, but it essentially means the same thing. But when we think of farms, it can be different things to different people depending on the context. But green care settings, I guess, are agricultural, horticultural settings where you do have a combination of farming activities, and it's with these health and social care interventions in mind. It doesn't always have to be for people with dementia. It has been for people living with disabilities or other special needs or mental health issues or whatnot. So it has been varied depending on the target population. And it's really to create a supportive environment where we can just benefit from that space and that natural setting that we all have. Okay, so when we visited the Netherlands, we wanted to learn more about these green care settings so that we could implement them in Canada. Our observations of the Netherlands is that they were much more family and community oriented. They still had fairly larger family size. There's a bigger emphasis on physical activity. We found that people were quite busy socializing, being in groups and having whether they come from the home setting or if they're living in the green care settings or if it's more a part of a day program. We did find them to be quite active. There's also more investment we found in the Netherlands related to respite and day programs where the government does allocate a generous amount of funding for them to be able to do that. So care partners do have more time to themselves, we find, versus here in Canada. And we also found that there's a big emphasis on sustainable development and social climate. So they're also trying to reduce waste and give back to the community. And if there's a surplus of vegetables, they'll share that with local food banks or those in need. And the businesses seem to be well supported through these contractual commitments too. So for example, a butcher might come and, help with the animals and whatnot. And in addition, they give them, some sort of vegetables back. So it's like a nice mutual exchange. And their observations of Canada is that they found us especially very safety oriented and afraid of risk. And I think there's also that feel of the States where we're often afraid of lawsuits and things like that. So we're afraid to make these big changes because of that. So they do find that compromises our autonomy and the freedom of our people with dementia to function as best as they could. So those were kind of their observations of us. And, we saw them riding without helmets and we're super concerned, but they accept those risks and they feel comfortable in doing that. So there is a need for a little bit more freedom when it comes to that. These are photos from places we visited. So we visited day programs. The first photo with the table set there, it was actually a winery and people living with dementia would come and visit and they would have patios set up. They wouldn't make the wine though, but they could appreciate it and enjoy that as well and just be in this nice, this beautiful wine vineyard where they can actually enjoy and explore. And then we also visited the Dementia Care Village, the first of its kind in the Netherlands in Amsterdam as well. And it was really nice to see where this all originated, and we've come a long way. We're implementing these more concepts more so in Canada as well. And then there's also short and long-term stays. So there were some green care settings that were actually meant to be care homes for people. So they actually stayed there 24 hours a day and had access to all the care that they would need. These are some quotes from the green care setting owner. So some of them that's really struck out to me is like, don't build an institution, build a home. Oftentimes we're thinking about making these spaces, making little rooms, but there's no communal aspect to it. So in green care settings, everyone shares the kitchen, the dining area, people all pitch in for cooking. So you have people with dementia cooking as well, making their own meals. And it's just it's a home-like environment. It's not so much where you're sitting and waiting for things to be done for you. You're actually having it's active participation in how you want to live and how you want things to go about in your day. So that was really, really striking for us. Another green care setting owner mentioned, life doesn't stop. So even if you have dementia, there are still things that you can contribute and there's things that you can do, as we're all aware. So you still need to walk the dog or you still need to harvest the vegetables. So these are tasks that keep people busy, and it's just really part of normal day life. There was a really big focus on creating that normalcy as much as possible. So what we found that green care settings have in common is that social environment, it's really relationship centered. They remove all of the hierarchy. So you actually have staff who are working and they don't wear uniforms. So you don't know if someone is living with dementia or if it's staff, and it really doesn't matter because everyone's pitching in and helping at the same time. We even were served in the tea houses by people with dementia, and they took our orders, and it's just everyone's on the same equal level. Leadership as well. Nurses are taking out the garbage, and there's no discrimination of roles. We're all just helping to create this really safe environment. The physical environment too is very open. There's fencing, but the fencing are to keep the animal in. It's not to keep anyone out. So people with dementia are welcome to walk around, and some of them walk out into the community. A lot of them do have GPS tracking devices and things like that. So if they do wander off a little too far, and the members of the homes can eventually go and search for them by car later. And a lot of people in the community are aware that the settings exist too, so they'll know that it's potentially someone who just went a little too far and couldn't find their way back. And there's a huge organizational culture where the leaders are really strong innovators who saw a vision, who had a vision and really took those risks to create something unique. And interesting enough, some of them didn't really have healthcare backgrounds. They weren't all nurses. We did meet some who were, but some of them came from more of a business model approach, and they just saw an opportunity. Some could have just, had these farms and they wanted to do something or give back to the community as well. So you didn't have to be a nurse. And actually, there's a big emphasis on having less nurses work here because you won't need so much medical care or focus on medications. There's always a nurse on duty, but they actually recruit folks who just have an interest in supporting people who have skills and interacting. So you'll have therapeutic recreationists or students coming in. So it really just depends on what skills people have. And there's a huge goal of normalcy where they're looking at active participation, just going about your daily routines so that you don't feel like you're moving in a different setting. This is your home, and to make it as home-like as possible. And there's intentional demedicalization. So there really isn't a nursing station. And if there is, it's the medication cabinet. It's like under the stairs and it's locked and tucked away. So to get access to medication it's not really easy to get to. And that's okay. And that's the whole point, because we don't want nurses to spend so long doing medications or charting. We want them to be out with people with dementia and being actively engaged with them. So that's why there's like an old desk where they could chart, and it's not comfortable. There's not even a chair for them to sit on, but that's all intentional so that nurses don't spend too much time just charting. So just focusing on the people who are actually receiving that care. So there's a paradigm shift that's definitely needed. We heard a lot. Oftentimes we hear therapy, care, risk management, those kinds of terms which are very medicalized. And in the Netherlands, they use more of the normalcy or participation or just simply living in the moment and just living in their environment. So there's a need to shift the way we talk about care for people living with dementia. There's also a need to focus more on what people can do, so more of a strength-based approach. Instead of focusing on what people can no longer do, what can we do to support them and use the remaining of their skills to be able to let them live the best life as they can. So see the ability, identify that, and embrace that as much as possible, and as a community in the green care setting. And then institutionalization also contributes to the excess disability. So we do need more of these types of care settings. And then the practical approach is making care settings less like institutions. So although we found in the Netherlands that 85% of folks could actually be well supported at home because of the funding that they get for respite, but they do need something to do for caregivers, right? So about 15% were receiving support in long-term care, but it can also still be a life. So even in long-term care, especially in the green care types of setting, they were still really much engaged, and they even had, even up until palliative care, there's still ways that we can bring them outside to enjoy nature. So some of the examples that we saw is that we really need to shift our way of thinking. So people with dementia can still learn routines. So some of these folks never lived on a farm, but when they came, they were able to, some of them really like feeding the pigs, for example. So every morning they would get up and feed the pigs, and that's not something they were used to. So we really shouldn't take that for granted that they can't learn new things. They're also, contributing in different ways, and things that that used to be normal. That's something that you do. You wake up, you tend to the yard, you sweep up after you're done eating. There's also we actually took these really steep stairways to get up into the rooms, and there's an elevator, but no one really uses it, and people are quite active on their bikes because it's just a great way to be physically active as much as possible. And nothing is simulated. It's a real tea house. So people in the community can actually come in and have tea with people living with dementia and the staff and everyone there. A real pool hall. There's a real jazz club, and so it's not music therapy. It's not a recreational program. It's just a club where people go to enjoy, just things that we would do at a coffee shop. The innovators were also quite striking when they did share about, how do they come about with these visions. But they mentioned if you don't like something, then you should do something about it. What do you want? What would you envision? So looking at what's feasible, grow slowly as you can. And they often said like shooting the bear. So if there are obstacles, just tackle them as much as you can head on. And then starting to change your ways. So instead of saying we can't do that, or we should say, how can we start to do that? Like, who should we talk to about things like that? And also accepting that there will be risk. So, there is risk for everywhere, right? And there's maybe more so in the green care settings, but it's something that, perhaps people are willing to accept that risk for a better quality of life. So balancing that quality of life and the risk that people are willing to accept. And then that shared sense of responsibility is really important as well. So I think this is probably language we've often seen or used, especially in healthcare settings, but we really need to shift our way of thinking. Instead of saying we don't have enough money, how could we redirect our money in different ways so that we could be more efficient with the care we're providing. We don't have enough staff, so perhaps it's not necessarily hiring more staff, but looking at who could we hire, or what could staff do in changing their roles. Oftentimes we're worried about what the unions will do to prevent change, and their rules are different, ours are they're different, and it's not going to work here. So looking at how can we change the minds of our policymakers. So right now we've had some SSHRC funding. So we have implemented green care approaches actually in Langley Village in British Columbia. So Sharon Kasalainen's leading that with myself as co-PI, and Dr. Habib Shadouri as well works in the Langley Village and has done lots of work there. And we've also done some work in Haliburton. So in Ontario, we've also looked at some of those green care approaches, and there's growing interest among farmers across Canada. So we're venturing now in Montreal, where we've interviewed some farmers and asked them what do they think about this concept, how could it support diversification as well of their farm, how could it be perhaps an additional source of income while still giving back to the community by supporting people living with dementia. So that's all in talks. Okay, so that's green care farms. Third study I was going to talk about is looking at equine assisted activities for people with dementia in long-term care. So this is a study that happened locally in Haliburton, again in Ontario, and we were looking at whether or not having little miniature ponies come into long-term care, how that might improve the quality of life or provide some benefits for people living with dementia. So equine assisted programs, it involves interactions with horses, and it doesn't have to be the big horses pictured here. It could be the miniature ponies as well. And it could be something where you're just observing them, or it's more active, such as petting, grooming. We didn't get into riding. I think that's a little bit tricky with the horses. That would take a lot more skills for that, but observing as well. And there's lots of therapeutic benefits that we found. So there's lots of physical, emotional, and social domains in terms of being with horses. We found that people are much calmer, their mood has improved in the literature, but it's still somewhat of a newer venture for people living with dementia. So we wanted to explore that a bit further. So the program that we evaluated is called REAP, and it's out of the Walkabout Farm Therapeutic Riding Association. And that program was created in 2024. This farm, though, existed for a while, but the owner, Jennifer Seamack, was doing more of these therapeutic programs for people, young children or children with autism and youth. And then she decided she wanted to look into long-term care and people living with dementia. So we partnered with her. So she did all of the site visits and she brought in her staff to into the homes. And as you can see, there's a photo of Jen, and this is actually one of the miniature ponies that she brings into the homes, and they fit into the elevators, and it all works out. And the residents are really happy to see the ponies when they do come in. So the horses provided full sensory engagement for the older adults, and they're hosted either indoors at the home, so they would bring them up on the elevator, or if the homes were able to travel to the Walkabout Farm, this could happen on site as well. So a couple of options there. So some of the benefits about horse therapy is that it really provides, at least with children with autism, we've seen there's improvement in motor outcomes and their functioning, and it also makes them less, reduces that irritability. In older adults, it has been found to enhance their physical health, where they can actually move around and also get up to see and pet the horses or ponies. And we find that interacting with horses can be quite calming, and you don't really require a lot of communication or verbal, but they seem to understand and reflect you, and they really feed off the energy of humans as well. So it's really found to have some really good effects. It has been found to increase the serotonin, so make people, much more happier, promotes the emotional well-being. In terms of cognitive and emotional benefits as well, it has been found to reduce depression and provide better functioning in terms of cognition. And there's also really broad therapeutic value in doing this too. And it also creates more of a social group where everybody comes around to interact with the horses. So as mentioned earlier, we did find that there wasn't really a lot of research about these programs for residents in long-term care. So we thought to evaluate that at least on a small scale, because they're a unique population and there hasn't been much measures there. So we did focus on some quantitative measures, and also we did some qualitative interviews with residents and staff members about their perceptions of this program. So the purpose of our study was to explore the feasibility, whether it's something that can be implemented, if it's acceptable to residents, families, and staff, and also some of the observed effects. So just raw, data, because we didn't have a lot of we didn't use technology to measure, but just from what we could see before and after programs, were there any changes? So we had 9 residents take part in that. I won't go through the demographics in too much detail. And then we also had 4 staff member, but we only had demographics for 3 because we couldn't locate the 4th person. They might have changed or whatnot. And unfortunately, we didn't get a chance to interview families and friends of people living with dementia. So that's something we'd like to do moving forward to get their perception as well. So most of the residents attended between 3 and 5 sessions over the 3-month period. So oftentimes they would try to do this weekly as much as possible. And most of them had on average a 3.7. So between 3 and 4 was really the average. And the sessions lasted around 60 to 90 minutes each time. And the engagement we found using Cohen-Mansfield engagement framework is that it really varied, but it was moderate to high attentiveness. So they really were attentive to the horses when they did come in, and there's positive attitudes towards the stimulus. Those who might have been initially frightened seemed to become more comfortable as the ponies did come in, and they were really happy to see them every time and looked forward to that. And there were no dexterous or cognitive difficulties, so we didn't find that it was overly difficult for residents to pet the horses or to groom them or interact or even come up to them. So they didn't really have any limitations there. So some of the findings, we found that there was increased interaction. So we found that the residents really spoke softly to the horses. So they were really gentle in approaching them. And this is good for the ponies as well, so that they didn't feel threatened. So both ways, it was just a really calming session. This is a photo of the ponies. So to remember their names and look forward to seeing them. So there's quotes of residents resting their head against the ponies and kissing the nose gently. A lot of them felt like they could build a relationship and adjusted their behavior. So they knew that if they were frightened, that this would also affect the ponies. So they really were mindful of that. And some of them really liked coming to the farm and really enjoyed just being in a different environment as well. There's lots of positive responses and enjoyment. They found that the mental and emotional aspect was really, really powerful, having the horses come in. They were complimenting the horses and they just felt really, really positive. And some of them, felt that even though they were initially afraid, they soon came to feel comfortable and came out of their rooms to engage in the activities. And it was just nice, staff mentioned, to see the progression of how comfortable they felt over time. I think reminiscing is a really big, and I just find that that's really neat because some of the residents had experience growing up on the farm and they used to ride horses or they used to see horses just like these. So it really took them back to times that were positive, and it's really a nostalgic experience for them. And some of them haven't seen horses in years. So be able to see them come into the unit was really a nice surprise for them. And then it also helped to kind of, if they're not if something happened, for example, someone had their brother's death, they could think about something more positive. It just gets their mind off things for the day and just brighten things up. And it helps to create those stories too. So staff could probe into, what was it like living on a farm and all of those, those things that really create the stories and help them know them a bit better. We also had some residents that if they knew, there was one man, he knew that the horses were coming, he would have his cowboy hat and his belt buckle and he was just ready to go so it really shaped their identity too, and they really wanted to be fully present for those activities. So the next steps is publishing the findings. So again, I hope there's a lot of promises, but I do hope to eventually publish these findings. I have presented this at the AAIC last year, a few other conferences, but we do have a publication drafted, and it's just in the middle of being reviewed by the whole team, and hopefully we'll find a nice journal for that. Okay, so the last study that I'll be talking about is looking at personhood for people living with dementia through stories in motion guided by nature. And this is my current project, part of my startup funds offered through the School of Nursing. I also received a little internal McMaster University international grant that allowed me to travel to Scotland as well. So this is the reason why I guess I'm here as well in BC, visiting all of the programs this week. So the reason for exploring some of this is that I often find that current care models are often task-oriented, and we're still in the literature, we're finding that people living with dementia are offered less than 10 minutes per day of meaningful engagement. It's more pronounced in long-term care, but even at home, family and friends may not know what to do with people living with dementia, especially as the dementia progresses and they're experiencing more losses, for example. So this often causes that marginalization, and we're not supporting the identity of people living with dementia as much as we could. So the rationale for this project is looking at personhood. And we find that this is really essential for the dignity and quality of life. And I'm sure this is also at the forefront of the center, looking at personhood as well. And I find that nature-based activities and storytelling, these are both really great activities that have been found to improve mood and encourage that social interaction between staff, families, living with dementia, and support their meaningful engagement. So I'm looking to combine both these interventions into a novel approach that could support the individuality and expression of people living with dementia. So Stories in Motion, it's not something that I created. It's actually by Faye Wilkinson. She's a therapeutic arts practitioner, and she's implemented this digital storytelling process for people who are living with cancer. And she's tried to venture in different areas, and she has implemented a little bit of this in long-term care, especially when in the winter months when there isn't much for people to do. So it's a great way to have people living with dementia and long-term care share their stories using these metaphors. And she creates these 2 to 3 minute video clips, and it's narrated by people with dementia. And she's even able to elicit stories stories with people with more advanced forms of dementia too through her frequent meetings. So this is essentially what I'm trying to do. And with my learnings from BC and in Scotland, we are going to adapt this process so that we can make this as robust as we can and ensure that we're using elements that are found to be beneficial in the literature. So the project aim is we're hoping to design this intervention, implement it, and then evaluate stories in motion guided by nature. So we do want to incorporate some sort of natural element, whether we're doing this outside in nature or if we're going to talk about natural elements such as the weather into these stories so that we could support the personhood of people living with dementia. So I have 3 objectives. I won't read them all. And my first study is what I'm currently working on is the qualitative site visits in BC and Scotland. So doing a bit of a scope of what's already out there, what could we integrate into our intervention? And then Faye will take on study 2, and then we'll look at mixed methods evaluation using surveys and interviews with folks in long-term care and also day programs. So essentially we're hoping to create something that's going to improve the social interaction and well-being of people living with dementia and support their dignity and help healthcare providers, healthcare students, and families understand that people with dementia still have a lot to tell us through their stories, and we can actually support them by giving them a voice through this approach. So that's a little bit about that. And because I do have data that's just really new and it's fresh out of the oven, I haven't done any write-ups, but I've taken lots of photos. So what I've decided to do is really go through the photos of the sites that I visited. So this is, you'll be the first to see these photos in a public presentation. So that's great. So I visited 4 sites in Scotland, and I did some interviews with 4 program managers, and each of these programs are quite unique. So the first one we visited in Scotland was a botanical garden, and they're starting to explore the possibility, and they've done some sessions where they invited people living with dementia to come and take part of the activities here in the botanical garden. So right now they're more catered towards people with living with disabilities, but they are now exploring how they can include people living with dementia, how they can bring them on site and have them take part in planting, gardening, harvesting lots of fruits and vegetables here on site. So this is one of their many tunnels or greenhouses that they have, and they have, really good support and foundation. It's actually an existing botanical garden, and they have one section that's dedicated to implementing the program, which is great to see. So there's lots of, it's all free to come to the botanical garden. There's beautiful, flowers everywhere. There's also ponds, and people are, welcome to walk around and just enjoy the sites. And it's open to the public as well, so you could have a mix of people coming in, which is nice to see as well. And then they also have lots of, they've received some generous funding, so they've had funding to create this educational setting. So this is like a shed where people can come in and do some learning and things like that. So, and then they have new builds that are often happening and new greenhouses being built too. And they're composting, which is great. So it's really, great for the environment, the practices that they're using. So children actually do come and learn as well. So they're also looking at exploring, I think they were looking at maybe mixing, having children come in with people with dementia as well, and having that intergenerational mix happening. In terms of the botanical garden, what struck us as really interesting too was the fact that they also create these planters. They create these planters for the city so that they can actually get a bit of a source of income revenue coming in. So by creating these planters, they get a little bit of money that can help support the program. So I thought that was a really neat way to get some. So that was one of the first sites. And then we visited a therapeutic animal farm. And it's owned by one person. She has lots of land and a variety of different animals. Here we've pictured some, and they're really docile, and they're not very frightening at all. So she has horses, she has ponies, she has dogs and like roosters and hens and ducks and everything, and they just roam around in the open area, and there's goats and sheep and everything. So so she actually goes into long-term care homes, and she can only bring certain types of animals. She can't bring the ones that are that have closed feet. because of risk for contractions. I think she said hand and foot disease. So there's specific types of animals that she can bring into the home. So there's a bit of policy around that. But people are also welcome to come in at any time to visit the homes. To visit the farm on site. So she's doing that for people with dementia. Here are photos of ponies and their hair a bit, shaggy there, but they're just really fun way to engage folks coming to visit. And then, here are some sheeps. And this is just some of her land that she has. And she has one volunteer and she does this a few days a week. And she also works full time in the ED department as an ED assistant or so. So she does have some healthcare knowledge. And then the third site was an outdoor center for people with dementia. And I have this photo here. It's actually a zip line. So they actually created the zip line where people who use wheelchairs can actually zip line through this. And then the ramp allows you to bring the wheelchair up and down. So it's really a nice, inclusive environment. So they have people living with dementia come here. They can enjoy the sites. They can do some hiking. They also, they also can do some foresting and just walk around, and it's a beautiful area. And they have an area for people with dementia. There's an area for the public where they can do some hikes. So they're not, it's not exclusive to them, so they can still interact with the community. So it's a really, really neat way. And it's also funded by the Alzheimer's Scotland. So they provide all kinds of resources. And this is just some of our researchers. We did this activity where we looked at how this outdoor center really links to different sectors, health and community services. So this is why the web is so big, because people who come to the outdoor centers are very well connected. So there's strong connections with their GP, for example, for their social workers. So there's really great communication about the needs of people living with dementia. And when they get referred here, everyone is aware of that as well. These are just some birds, and so there's lots of natural setting, natural sites that can be seen. And the fourth place we visited was in a forest, and they actually this is one of their cabins, and this is also for people with dementia. They can go on hikes, they do some cooking together, so it's a very inclusive environment. People bring their dogs, people can also bring their family members or friends and do all sorts of activities, and they also do traditional dances and things like that. And there's ponds, and it's a really vast environment. So they always have a lead that takes them around the park, and people do as much or as little as they can, so they can always turn back if they can't finish the whole walk. And there's a lovely gorge that people can see, and a bridge as well. So this is one of the ponds where there are a bunch of tadpoles there. And there's lots of seating. So we found, they really create wonderful seating for people if ever anyone needs a break. So there's these makeshift benches just all over the park, and it's also open to the public. So everyone, is welcome to come here. And again, yes. And then they also have a lot of arts-based activities too. So they actually have someone who comes in and creates stories with people with dementia. So I was really interested in that aspect. So they've created the quilt, and they also looked at different elements of nature to create these stories in collaboration with people with dementia. And then, there's seating, and it's just, really, really neat place to be. So I'm almost near the end, but I think in case there are trainees online, there's some things I like to just share about my journey that might support others who are interested in finding their grounds in an area of research. I would just say, make sure you find an area of research that you really care about and you really feel strongly about. I often say you'll be roommates with this area of research for a while, so make sure you could stand them as much as you can. And just think about what fuels your curiosity, what makes you wake up every day and think, oh, I wish I knew more about this area. Building your collaborations through networking. So I've met, a number of colleagues through conferences, and that's why, I'm able to be here today in Vancouver to talk, because of the networks that I've built throughout my studies. Giving back to the community through volunteering, either through sharing your findings. I think that's really important, so that we don't always share within academia, but the community is really interested in learning more about what we're doing at universities, and they also want those resources to support them. So offering your time and expertise in meaningful ways. being kind to yourself and patient. I think that's really important because we're going to go through all kinds of obstacles. We'll make mistakes, but all of these are learning opportunities for us and a chance to improve moving forward. And I think just avoiding comparing yourself to others. You know, sometimes you get funding, others don't. Sometimes others get funding and you don't, and that's okay. You just keep trying and keep plugging away and recognizing your own strength and what you could bring and what you could bring to a team environment as well. And also mentoring others as you grow. So even if someone is just, you know, entering their second year and you're your first year PhD, you can still be a really good mentor for someone. So sharing what you've learned is really important and giving back to others in that way. And I think just like the Green Care farm owners or the Green Care setting owners, take risks. So take as many risks as you can, and you never know, you know, what that could lead to. It could lead to something really, really wonderful if you think a little bit more creatively and move out of your comfort zone. So that is, that's it for me. So yeah, thank you so much everyone for listening. And I do look forward to hearing more about your questions.
Thank you so much. I must say the words of wisdom for trainees are words of wisdom for us all. And that was just icing on the cake
Thank you.
after this very generous presentation sharing these work projects. So